All right. Well, hello, everyone. This is Bill Riley. I'm the director of OBSSR. I want to welcome all of you to today's webinar. The webinar is entitled Using Smartphone and Motion Sensor Technology to Study 11 and 12-Year-Old Sleep Lessons Learned. And our presenter is Tim Spilsbury. Before I introduce him, just a couple of housekeeping items. Today's webinar is being recorded, and that recording will be available approximately 1 month from now, so you can look for that if you want to listen again or point others who missed this webinar to it. All of your phone lines are muted during the webinar. We'll have a question and comment period after Jim's presentation. You'll see a chat room on your screen. It's either lower right or upper right, depending on how you've got your webinar system configured, but you can just type in a chat to all participants or all panelists. And you can type in your question and hit send, and we'll read those to Jim if he can't see them, or he can read them. So we can get your questions in that way at the end of the session. By way of introduction, Jim Spilsbury is a program director at the Center for Clinical Investigation in their Educational Development Corps. Received his Ph.D. in Anthropology from Case Western Reserve and his MPH in Health Education from the University of North Carolina at Chapel Hill. In the last 4 years, Jim has served as instructor in the Center for Clinical Investigation and a scholar of the Multidisciplinary Clinical Research Training Program, one of the NIH roadmap initiatives to train future leaders of the nation's clinical research workforce. This program is conducted collaboratively by Case Western Reserve, the Cleveland Clinic, the MetroHealth Center of Cleveland, and the University Hospitals of Cleveland. So Jim, thanks so much for presenting, and I'm going to turn this over to you for your presentation.
Okay, well, thank you for that introduction, and I want to thank all of the participants for logging in to hear this seminar and me to have the opportunity to talk a bit about this study using smartphones and sensor technology, try to understand a little bit more about 11 to 12-year-old sleep. So I usually start a presentation with an outline or a roadmap to try to give the audience a little idea about where I'm headed and to kind of keep me on track as well. But the more I thought about it as I prepared for my remarks, it seemed like there was one kind of continuing challenge with using these types of technologies that I felt like I needed to bring up and state from the get-go. And that's that the technology is ever moving, ever evolving, and it's a real challenge keeping up with that technology. I ran cross country in high school, and this is how I usually saw the race. Probably about 2/3 back in the pack, trying to keep up with those folks up in the front, and I felt very much like that's what this has been like, or I experience with these technologies as they change. So and to be honest with you, the sensors and the smartphones that we use in this study have already been superseded by newer devices. So rather than go into the details of those devices and some of the details of the results generated from those devices, I thought it might be more useful maybe to talk about the challenges that we faced in doing this kind of project, some of the decisions that we felt we had to make, and then some of the advantages and disadvantages of those decisions. And hopefully this will be useful to you regardless of the technology that you're using or considering using. So here's my presentation roadmap. I want to say a little bit about me, give you a big picture of the study, and then I thought I would talk a bit about the system in brief, to help you kind of get a feel for what it is overall, what it is, how it works. And I thought that would provide a good sort of framework or structure. You'd see the system and then be able to better appreciate some of the challenges and decisions that we had to make, and ultimately some lessons I feel I learned from this work. So a little bit about me. I'm an anthropologist. I'm interested in child health and well-being, and in particular how characteristics of the social and cultural environment shape health. And I've developed an interest in sleep in particular. The study I'm going to talk about has its origins in a cohort study that occurred, well, over 10 years ago now. The Cleveland Children's Sleep and Health Study followed about 800 children over time. And these are some data that we analyzed and published on children's adjusted mean sleep duration. And that's on the y-axis, and on the x-axis are different ethnicity, gender groups in the sample. And you can see, and it's probably no surprise that hope you can all see my cursor, that the children sleep for each of these groups at 8.5 years. They were sleeping more than they were at 10.5 years. And as we looked at these data, I was particularly intrigued with this group here of the African American boys, and piqued my curiosity about the social environment and, you know, what might be some of the factors that are driving that observed decrease in sleep duration compared to the other groups. So the study with this technology, the sensors and smartphones, really have their birth in this earlier study. And as we thought about the study, we were particularly intrigued with the idea of trying to utilize ecological momentary assessment approaches. I used Stone Schiffman's definition of EMA, which is a collection of methods by which a research participant repeatedly reports on symptoms, affect behavior, cognitions, close in time to the experience and in the natural environment where those things are experienced. And at the time of thinking about this study, EMA was being used in children and adolescents, typically in areas around obesity and physical activity. So this is a map of my neighborhood in Lakewood, Ohio, and if my 14-year-old daughter were participating in one of these studies, she might get a some kind of sensor. She might get a smartphone. The smartphone might be programmed to randomly prompt her, and it might collect some information, might ask her some questions about, you know, what she's doing, where she is, say if she's tired. So for instance, at, you know, 9:30 a.m. she gets a prompt, what are you doing, how tired are you? Say the study's interested in fatigue. And she gets another prompt a little later at the high school at 10:15 a.m. and then another random prompt at 12:40 and one at 1:15 where she's up near Melt Barn Grill, a favorite place where she goes to lunch. And then finally at 3:45 she gets another random prompt at Madison Park. We were curious to see, could you use this approach in any way to study sleep? And in particular, the sleep of 11 to 12-year-olds. Again, that age range where we saw that interesting drop in sleep duration. Now, we can't wake up people to ask them what's going on, but we can perhaps use this approach to collect information around key time points, like bedtime or wake time, or maybe to collect information around key events or concerning key events, like the activities of the boy or girl or other household members at a particular time, or even perhaps nighttime disturbances or events that are occurring at nighttime. So this, in a nutshell, was the study. It was titled Peer and Family Effects on Urban African American Children's Sleep. It was graciously funded by the National Institute on Minority Health and Health Disparities. The aims of the study were to determine the effects of peers and family organization on sleep timing and duration, and to determine the effects of peers and family organization on these activities in the household that are going on before and after bedtime, and then the effects of nighttime activities on sleep duration and timing. And then the last aim in particular, to collect usability and feasibility data on an innovative phone sensor system to design to enhance measurement of nighttime activity. This is our research team. Myself, Nathan Morris, Jen Frame, both all from Case Western. Nathan's a statistician, Jen our research assistant. Stephen and Tilly and Ida are from Northeastern University. Stephen's an engineer and Ida is an engineering grad student. And then Sanjay Patel, who's a physician and a sleep medicine specialist at the University of Pittsburgh now. give you just a little feel for the study itself, the participants, we had 26 children, all were 11 to 12-year-old, mostly female, mostly African American, according to a parent report. And the 19% mixed in this sample were parent reporting part African American and then another race or ethnicity group. The median family income was $22,500, and about a third of our participants were living in public housing. I thought you might be interested in the sleep. This study was all home-based. It involved 14 nights of measurement, and to give you kind of a picture, 46% of the boys and girls were sharing a bedroom with at least one sibling. Their average bedtime was 11:52 p.m. Average wake time, 8:07 a.m. Average nightly sleep time, 7.7 hours, which is less than that which the National Sleep Foundation recommends for boys and girls of this age. And the average nightly sleep efficiency was 90%. So this system used a sensor that Stephen and his group developed called a Wackets, after Dr. Seuss's There's a Wocket in My Pocket. And a Wocket is basically an accelerometer. And for those of you unfamiliar with the kind of accelerometry uses to develop sleep measures, an accelerometer detects body movement in different dimensions. It takes a measure several times per second. It then translates these movements to digital counts in a predetermined interval of time, or an epoch, and that could be a second or 30 seconds. It could be a minute, and then it averages these counts for each epoch and stores that in this device. The data are then downloaded to a computer with a software program that analyzes the data. Each of those epochs is categorized as being sleep or wake based on a validated algorithm. And then you can use these sleep-wake categorizations, or I should say the program uses these categorizations to calculate a range of sleep parameters like sleep time, the number of nighttime wakings, the wake time after the onset of sleep, sleep efficiency. There's a variety of those parameters. This is these are a couple pictures of the Wackets equipment. So here again are the sensors, and each boy or girl got 2 of them. They came with a band that they would wear around their wrist. Here's a picture of that. And we also gave each boy or girl a charger. So the idea was that they would put one of these Wackets, in the wristband, wear it, and then the next day we tried to have the boys or girls, to help them remember to swap the Wocket, be as consistent as possible. So maybe swap it, before they go to bed at night, or when they're getting up in the morning, or some kind of standardized time over the course of this 2-week period, and so they'd keep one in the charger charging, they'd wear the other one, and then the next day they'd put in the new charged Wocket and put the uncharged one in the charger to charge. So the way the system worked then is that the information, that accelerometry information from the Wocket, would be transmitted through Bluetooth technology to a smartphone, which would then transmit the information to a secure server. We used AT&T as our service provider. And that information would then be downloaded to a computer and processed and analyzed. And what you're looking at in the middle here would be a real-time, it's the visual display of the data. And this just showed a wealth of information, everything from, activity, motion counts, to the status of the battery in the Wocket, or the status of the battery in the smartphone. I mean, just, you could really keep track of sort of everything with this display. And lastly, I might mention that if, whoops, that shouldn't have happened. There we go. If there was a little feedback here, and that if you were looking at your display and you didn't see anything, that might be an indication that either the Wacket's out of juice or it's not being worn or there's some malfunction, and you could then contact the family and try to troubleshoot to see what the problem was. This system seemed to had some real advantages. One, as I mentioned, it's real-time monitoring of movement and sound. The microphone in the smartphone could be used to measure sound. You could use the smartphone to administer surveys. And one of the interesting features of this system is that you could link the movement or sound that you're monitoring to the survey itself. So if over the course of the evening there were changes or spikes in motion or a big noisy event or something, the program could be set up to ask a question about that event in the survey the following morning. So it might look like last night around 11 p.m. you moved around in bed a lot, maybe even got up. What did you do? These are some examples of the survey pages that they're display on the smartphone itself, to give you a feel for what those look like. And I wanted to list some of the example surveys that are questions that we asked. So at bedtime, one of the questions we asked were, what are your family members doing right now? And they, each boy or girl could select, any of the following activities that were going on in their household. These activities were derived from our previous research in Cleveland with families with children of the same age range, as well as some from the literature, and then in particular some items that showed up, you might say, during our pre-testing of this equipment that we did with 5 boys and girls. Another question that was asked was, so the previous one was about activities of other members when you're going to bed. This one was specifically things that other people were doing that's keeping you awake or making it difficult to sleep. And again, a list of activities that they could choose from. I might add that the last 2 items in these lists, something else and nothing, we purposely put those at the end of the list so that as children were scrolling through, you kind of want to minimize the screens that are involved. So you have to be really judicious in your list of possible activities. And we put something else and nothing at the end, thinking that hopefully that might prevent the boys and girls from just saying nothing or right off the top automatically. At least they're going through the list and reading what the other activities were. To give you a sense of the data, what it might look like, so this top panel here, these are those household member activities, things others in the household are doing when the boy or girl is going to bed. And the way this is presented on the x-axis, these are a range of those possible activities. And on the y-axis is the proportion, and that's the proportion of nights that the boy or girl indicated that this was happening. So for instance, each one of these little diamonds is a boy or girl, and the ones that are a little darker are 2, or multiple kind of on top of each other. So this is one boy or girl who indicated that the proportion was 1. So every night that he or she filled out this survey, answered this question, there was another member of the household that was going to bed. The lower panel, these are the activities that the boy or girl identified that were going on that was particularly or specifically making it harder for the boy or girl to go to bed, to get to sleep. And so you can see as an example here are looks like 4, there's probably 2 there, so it looks 4 boys and girls who indicated that this would be about 90%. So from 90% to every night, there was at least one person in the household who was watching television or listening to music, and that was making it hard for them to go to bed. Here's one where it's between 80 and 90% of nights where a boy or girl reported someone being on the phone or texting was making it hard for them to go to bed. In the morning survey, in addition to asking some questions about what time they got up, we also included these questions that were linked to previous night events. So this is the one around motion. Last time around, and then the program would specify a particular event by time. You moved around in bed a lot and maybe even got up. What did you do? And same thing, the boy or girl would scroll through these and pick out the appropriate response. And a similar question for the sound event, basically. Same idea. So that's the system, all in all, about how it was set up and supposed to function. And there were many challenges that I, as a technologically unsophisticated individual and anthropologist, encountered, or that our team encountered. There was a lot to think about this, and a lot of decisions to be made that I must confess I hadn't fully appreciated till actually getting into this project. So one of the first ones, of course, is just the challenge of working with people who are trained in a different field. They speak a different language. They have perspective, a different perspective about the world and topics. I'm from an anthropology background, so I'm kind of big in experience and meaning and description, the context. This is a picture of Stephen and Tilly, the engineer, sees the world differently from the way I do. And, clearly a challenge learning to work with other experts from other disciplines. I don't know, those of you who are familiar with that old show now, Star Trek The Next Generation, Captain Jean-Luc Picard, the captain of the Enterprise, would always emphasize his commands with "make it so." And I feel like I suffered to some degree from what I called "make it so" syndrome. In, oh yeah, we want to link motion to a question the following morning. Okay, make it so. And as I said, it was only as working with Stephen and the rest of the team that I began to fully appreciate the complexity and challenge of developing the algorithms that are going to actually identify the events that we're interested in and then ask about them the following morning. And a little later on I'll talk about how those were selected. I think another challenge coming out of this, again, my inexperience, if you will, with this type of work, is the real time that's needed for development and pre-testing and modifications needed of a system like this. That it takes a while to really get the system going. And I think I underestimated that looking back at it. So that's a challenge. Team science has a lot of benefits and the richness of people from different perspectives and training coming together and working together and collectively seeing something in a new way. And there are certainly challenges associated with that. One of the immediate sort of decision points we had to make, which I might add is not trivial, which is whose smartphone are we going to use? So Stephen's previous experience with EMA involved adolescents and physical activity, and these adolescents largely had their own smartphones. So you could basically download the necessary software on that phone and use it. And, clear advantage to that, the participants used to the phone. They'll keep it, they're using the phone for other reasons. They'll have it charged, all that sort of stuff. Of course, the disadvantage is the participant has to have a phone. We're working with 11 and 12-year-olds in this study, and it didn't seem likely that children at that age would have a smartphone. That might have changed now over 2 years. But we decided to provide our participants smartphones, basically. There were a couple of cases in our 26 kids of children who did have access to one, but we supplied a Nexus 4 to all these boys and girls. Advantages of, you're sure you're going to have the equipment there. You're using the same phone all the time, so in that sense it's standardized. It's unlocked, so it makes the software easier to manipulate. Surprisingly, one of the disadvantages I encountered of this, getting the phones and plans, I might add, directly, was my university purchasing department's unfamiliarity. at the time with using smartphones and data plans for research. Their whole system was set up for phones for personal purposes. And although we had negotiated a really good price with AT&T for a data use only plan, my purchasing department had real trouble kind of figuring out how to process that, and it literally took months to get this all sorted out. Another disadvantage, of course, is that you're buying multiple phones and data plans, and that can be expensive. Another decision point we have to make is, are we going to allow the phone to be mobile, or are we going to keep it stationary? And again, in Stephen's previous experience with adolescents and physical activity, boys and girls are wearing the phone. They have it on their person, and it's pinged randomly during the day, much like that example I gave in the beginning of my daughter hypothetically participating in a study. We decided, for good and bad reasons, not bad reasons, I guess, or advantageously and disadvantageously, that we would have the smartphone remain in a sleeping area. Given the age range that we were involved with, we were somewhat pessimistic that these 11 and 12-year-olds would remember our phone if they ended up going to a different location to sleep for a night or two, something like that. So the phone was always located in that sleeping area. If it was a bedroom, if it was a living room, whatever room they were using to sleep. The advantage of this decision, it's reducing the likelihood of lost or missing equipment. And you can also, when we go out to these families to start the study, set them up with the equipment, gives us a perfect chance. We're seeing the location, can help them kind of set up where this device was going to be, all that, and ensure it's a suitable location. Of course, the big disadvantage is the system then works in one location only. So if a boy or girl were sleeping at another place, which is not uncommon, then we lose those data. Once you got to the room, there were a whole other set of potential challenges. Sometimes the quality of the service wasn't, great, so you might have connection issues with, with AT&T. This is not a picture of a study participant's room, but their room was just like this, basically. It was a pair of bunk beds. There was no other furniture in the room. And so it became a little problematic about where are we going to put the smartphone, where are we going to put the charger, to charge the Wackets as needed. Didn't want to put them on the floor, and, putting them on the bed didn't seem like a reasonable solution either. Also, you could have issues with an outlet. Is there an outlet in the room? Or if there is an outlet, is it a good outlet? We couldn't do much about that first challenge of connection, but these other two, these TV stand and extension cords became sort of standard part of the equipment package, if you will, that we went out to households with. So at least we had these to try to help make that location where the boy or girl kept the phone as suitable as possible. I mentioned changing technology as kind of an overriding challenge working in this area. We, experienced our issues with changing technology during the study, in particular, experiencing unplanned smartphone software updates. And unfortunately, this issue occurred more in the beginning of the study, and then as we realized what was happening, we could make some adjustments. But what would happen is that the Android system update would occur automatically, and it would then mess up the software that we had put on the phone for our study. So as once we kind of learned what was or saw what was happening, we made sure the software was updated and then tested before the phone ever left the office, and made sure that auto updates were turned off. I might add the Nexus 4 also had a sort of a nagging feature for us, in that if you decrease the volume, there's the volume kind of button on the edge of the phone and an on-off switch, and if you decrease the volume and hit the on-off switch, simultaneously the phone went into airplane mode, which would then, rendered it inoperative for our purposes, and it took us a little bit to recognize that was happening. And again, this tended to happen more with the first few participants than, throughout the study. This is looking at this challenge through sort of a different lens. So this is a flow chart of the completion of the smartphone surveys. So you can see here, if you have 26 kids, and ideally they're going to be doing this 14 nights, there's 364 possible nights worth of data. And yet we had 272 nights of when the survey was actually available, 92 nights of missing data. And as I said, the big killer in this was these software issues, and in particular these auto updates that occurred mostly in the beginning of the study. Less of an issue where the phone being uncharged, or for whatever reason it was taken out of its cradle and then ran out of power, or a service disruption, the phone inadvertently put in airplane mode, and then of course boy or girl spending a night elsewhere. And then you can see out of those 272 nights when the survey was available, 226 nights we got a survey completed, and 203 next mornings we got a morning survey completed. And I suppose we expected the morning survey to be a little less successful, given kids are, these are kids also who are attending school, so they may be in a rush that morning, and the survey just, didn't get done. This is another way of looking at the participants' experience using the system. Same ideas that other figure that I showed you, where these are different things that might happen. This is the proportion of times. And here's that group where anywhere from 60 to 80% of their nights there was an issue with either the phone not being charged or malfunction. And most of the time with these boys and girls, it was that malfunction that I mentioned with the updating. So I wanted to speak a little bit about the challenge of how to identify a wake motion event to query, that sort of the complexity behind my Jean-Luc Picard Make It So syndrome. Based on our previous experience with boys and girls of this age, we expected, maybe something like 6 to 8 events per night that might be potential events to query. But, one of the questions that had to be asked is, how many events are you going to query? Are you going to try to query them, ask a question about every event? If you do that, what's the likelihood that a boy or girl is going to answer all those questions in the morning if they're in a rush to school? If you're going to select only certain wake motion events to ask about the following morning, how are you going to pick the ones that you ask about? Is it going to be based on the intensity of the motion, picture the amplitude of a wave? Is it the duration that you're interested in, or the length of the event, or combination of the two in some way? And then what about multiple events that are in close temporal proximity? Do you want to ask questions about events that might be so close together that they're actually reflecting kind of the same event? So to try to answer these questions, we first went to the literature. There's not a whole lot out there in the literature available to guide our decisions. We did find one study, Windsor and colleagues, published in 2013, that did a really interesting study, a home-based study with adults in actigraphy, and basically trying to understand how long did a wake event have to be at night for the adult to remember that event the following morning. And the results of their study indicated that it was a little over 4 minutes. I think 4 minutes and 19 seconds on average. A fair amount of variability in that, but nothing about 11 to 12-year-olds. But kind of based on that, we decided that we would set a threshold of at least 5 minutes in duration. So that's one of the criteria. We grouped events if they were less than 10 minutes apart to avoid asking multiple questions about the same event. Events were ranked by size, and there we used duration and intensity, so we're using both of those dimensions. We decided not to include events within 30 minutes of rising time in the morning because we didn't want to be asking about events that were really associated with a child, waking up, getting out of bed in the morning. So all the events that met these criteria, the top 3 in terms of size were then selected for query on the survey in the morning. Answering or identifying sound events, sort of a similar approach. You have to answer similar questions. Are you looking at amplitude, duration, or both? How do you account for ambient noise in the room? And again, how many events are you going to ask boys and girls about in the morning? What's feasible for them to answer? So these are the criteria that we came upon for selecting these sounds events. So we selected the 3 sounds with the highest amplitude peaks that met the following criteria. So the amplitude was higher than a threshold of 4 times the average sound amplitude over the sleep period. So these were events that really stuck out in terms of decibels or volume compared to the ambient noise in the sleeping area. They occurred at least 30 minutes from other noise disturbances that triggered a question. So again, trying to avoid a situation where you're asking questions about the same event. And that they were 30 minutes, at least 30 minutes from reported bed and wake time. So we wanted to avoid those noises or sounds that might be just associated with a boy or girl going to bed and then one waking up. And lastly, we decided to set the program, the system, so that we weren't asking sound events that were temporally aligned with motion events that we were asking questions about. So this just gives you an idea. This is the visual screen from the Wackets system of this is an 11-year-old girl, and you can see in the top part this is the motion, and down here's the sound. And these sort of reddish orange, I guess to my eyes, spikes and stuff, those are the activity counts. And then you can see how these sort of line here represents the system grouping events that are to be grouped. So these are each clustered motion events. And then the big pink line sort of represents where in this event the biggest or the most intense activity took, and that's the actual point that we were going to ask about time-wise. So these were the 3 largest motion events that occurred in this girl's, when she was in bed from midnight to 7:56 a.m. and she got up, you could see her with this motion just starting to get up around that time. 2:25, 5:29, and 6:24. And then down here is the corresponding sound. And so you can sort of see the ambient noise levels in the room. These spikes here, sound spikes, are ruled out because they're overlapping time-wise with this event that we're already asking about. And when you look at the amplitude of the sound events, these are the 2 that end up being queried, one at 1:26 and one at 7:05. So in the morning survey then, you could in principle get 6 questions, through 3 about motion events that occurred the previous night and 3 sound events that occurred the previous night. This girl happened to get 5 that one morning. Give you a sense of the motion events, what was going on according to the boys and girls. Out of 971 awake motion events in these boys and girls, 471 were tagged for query, on an average about 18 per child, range from 1 to 39. And you can see, unfortunately, the most frequent response was don't know. A little frustrating from our perspective. But you can see, following that, and this is in reduced frequency, variety of activities that the boys or girls were identifying that involved that motion. One thing we became interested in looking this, since we had people who didn't know what was happening or couldn't remember whatever, versus individuals who were actually able to identify a specific type of event, we became curious in trying to see if we could determine how long or active an event had to be identified. So these represents the results of some analyses of those events, the 471 in the previous slide. On the x-axis here is event duration in minutes, and then this is the probability that the boy or girl is going to identify a specific event, something other than don't know. And this figure is similar, but this is looking at the peak activity counter, the kind of intensity of the activity. And you can see, as you might expect, that, you know, generally as the event increases in duration, that the probability that the boy or girl is going to be able to identify what it was increases as well. But then it plateaus off. And you can see that, you know, on average, we never really got, this is an average for the 26 kids, about 50% recognition at best. And the other thing I wanted to mention is the small blue lines here are, these are the plots for the individual boys and girls. And I think, you know, to my eye, one of the striking things about this is the substantial individual variability in these 26 kids. You've got this group here that in very short periods of time are, you know, pretty good, at least from our sample, probabilities of being able to identify an event versus this group of boys and girls down here that plateau pretty quickly and are never over 30%. And sort of similar thing with the peak activity count. These are the queried sound events. There were 234 of them, a median of 10 per child. And again, and to our frustration, the most frequent response to the sound was don't know, followed by something else, sort of the double whammy. But then we did get some other responses. You know, these are in decreasing frequency of these events that were generating sounds or noises at night. I'm going to move on to another challenge that certainly involves the surveys, and that's that you know you have the ability to program the smartphone so that it can provide reminders or prompts or pinging to boys and girls to remind them to you know, complete the survey. And it's a real trade-off because on the one hand, obviously you want to be aggressive enough, if that's the right word, to effectively prompt. On the other hand, you know, these things could be making noise, they could be vibrating, and you want to make sure that you're not disrupting the sleep of the participant or others in the household for that matter. So we had to ask questions or answer questions about, you know, when to start this prompting, when to finish it, what type or types of prompts are we going to use, and, you know, we always wanted to give boys and girls, too, the option to not complete the survey if they didn't want to complete it a particular night. So we had to build that into the system as well. So these were the kind of rules around prompting for the bedtime and morning survey. For the bedtime survey, the first screen would appear on the phone starting at 4 p.m. There would be an icon on the survey, on the smartphone screen that the boy or girl could touch to start the survey. Based on our previous research, it seemed that 9 p.m. was a reasonable time to begin an audio chime or ping and vibration to prompt that survey. We weren't going to miss many bedtimes before 9 p.m. and the system was set up so that chiming or vibration would occur every 30 minutes then. And then this prompting would stop either automatically at 11 p.m. or when the survey was completed, or remember the Wackets system it's an accelerometer, so it's measuring motion, it's determining wake or sleep status, or the system detects that the person is asleep. And then for the morning survey, the first screen was programmed to appear starting at 5 a.m. I don't think we had to worry about kids getting up before then. We might have to wake up or worried once or twice about kids still being up then. But the screen for the morning survey would first appear on the phone starting at 5. And if the boy or girl were awake and getting up, they could, again, like the evening survey, click on the icon to start the survey. If the system detected that the boy or girl were awake, it would chime and vibrate every 30 minutes until the survey was answered, or until noon when the prompting would stop. The first screen of this survey always asked if the boy or girl were going back to bed or getting up. We were trying to avoid a situation where, let's say, a boy gets up to go to the bathroom, comes back to bed, wants to go back to sleep, but then, you know, we don't want the system to start prompting and chiming and vibrating. So they could answer that question and avoid that situation. And then this morning survey screen would stay on the morning survey till 4 p.m. when it would automatically switch over to the bedtime survey. I felt it critical to mention this challenge, a potential challenge of a study like this. You know, here we are trying to study sleep behavior, 11 to 12-year-olds, and of all things, we're giving them smartphones. And so it seemed like there could well be the issue of, does the smartphone, which we're trying to get kids to use in a particular way, change the behavior of interest, namely sleep behavior. So to minimize this, we had sort of two main approaches. One is that we purchased unlimited data-only plans from AT&T. So much to the dismay of some of the boys and girls, these phones could not be used to text. They could not be used to call other individuals. They were strictly limited to the to data use, basically. And then we also use the Kids Place parental control app, which in principle limits or limited the phone to the program of our study only, so they could do no other app. Although we did find out that one of the participants, one of the girls in our study, managed to circumvent this parental control app. She couldn't reproduce it when we asked her about it. I was willing to hire her on as a consultant, basically, to help us kind of troubleshoot this stuff. We think it had to do when turning the phone on, and then there was a brief moment of time when before that app really clicked in, and she might have done something at that point to be able to circumvent the app. But again, we couldn't do it, and she couldn't reproduce it. We found out about it because there were a lot of pictures on that phone when she got done using it. Another challenge that we faced in this was really addressing the privacy concerns of families. We're giving families a device that takes pictures, that can monitor and record sound, that can also locate individuals. Now we're monitoring sound as part of this study, but our study had, there was no part of it where we were taking pictures or geolocating children, but nevertheless, families knew that the phones can do these, and we really worked hard with families to make sure, as potential families were learning, or potential participants, their families were learning about the study, to make sure they understood what we were doing and what we weren't doing. And I think this is where the assistance and advocacy of some local community organizations and institutions were invaluable in helping us work with families, communicate this kind of information with families, because we obviously wanted them to be comfortable about this. I wanted to share with you some of the kids' views about the system. At the end of the 14 days, we asked the boys or girls a series of questions about what they thought about the Wackets, and many of them considered it overall a positive experience. Oh, I should mention here that our N, if you're curious about it, it changes to 30 because in 4 cases after the initial participant was finished, there was a sibling who really wanted to take part in the study. And so we went ahead and did that and figured that this boy or girl could give us at least some more information about their views about the system itself and what it was like using it. So that's why the N here is 30, if you notice it. So most of them thought it overall a positive experience, didn't find it hard to wear them every day. It was more difficult, and you can see that sort of split here in terms of remembering to swap those Wackets every morning or every day, at what time of day when they did that. Our previous experience with boys and girls wearing actigraphs led us to think that if one of these kids is going to be wearing this device, that their friends or classmates are going to be asking about them. And we always gave the boys and girls a little heads up and told them, if somebody asks you about it, you can always tell them that you're doing a sleep study or in a science study or something like that. And you can see indeed that a majority of the participants did have at least one friend who asked about it. One friend even thought it was a home detention monitor. But they largely voiced that this explanation they gave placated concerns about the device. Most of the children, indicated that the chiming was problematic, and kind of split. We had some that the chiming or prompting wasn't frequent enough. Others thought it was too frequent. Some thought the volume too high. Some thought the volume too low. I think we erred on the thought of, not torturing these families with this prompting. So we may not have had it frequently enough, or maybe the volume too low in many instances. By and large, the boys and girls considered it, an easy task to complete the questions on the screen. That is, to use the smartphone to answer questions. There were some individuals who thought the questions themselves some of the questions were hard, and probably not surprisingly, those were questions around remembering those motion events or sound events at night. And large majority of the boys and girls told us that they'd be willing to be in another study with Wackets. So we felt good about that. We asked them if there were any suggestions for making this kind of system easier to use. I don't want to go through all of these, but I thought some of them were really interesting. I mean, that we had noted this issue with the prompting or the reminders, and the boys and girls talked about, or some of them, about making it easier to change the volume, making the band smaller or easier, making the charger stronger in some way, or the battery in the Wocket, so there was less of a need to swap them every day, having reminders to swap the Wocket, making the Wocket stronger so you could wear them during sports, making them smaller. Small number of kids, but making the band that they wore with the Wocket in it, make that look a little more aesthetically pleasing. I have to admit it was sort of dull and ugly. And then lastly, making questions easier. For those of you that are interested, we do have one initial paper out. It's been published by Sleep Health on some of the data that were generated from this study on household chaos and sleep disturbing behavior of family members. I can kind of cut to the chase. This is one of the tables from that paper, and basically you see that what we were interested in in households with greater levels of you might call household disorganization. Was that related to specific activities at night that the boys and girls indicated were making it more difficult for them to sleep? And I've highlighted the row that shows the association between the household measure, in this case the chaos scale, that measures that level of household disorganization, and then a variety of potential sleep disturbing activities. And you can see that the more social disorganization, the lower the odds that the boy or girl was saying nothing was disturbing their attempt to sleep or making it harder to sleep. And then conversely, as this household chaos increased, there were greater odds of activities like people visiting the house, people listening to television or music when the boy or girl were trying to go to bed, or people on the phone or texting, and that making it difficult for the boy or girl to go to sleep. So lessons learned real quick out of this. A research team has to meet early and often. I mentioned the challenge of bringing people together from different disciplines, and I think this really helped us. That we met start from the get-go and met regularly every other week throughout the course of the project, and sometimes more often as we were getting things going. Planning for adequate development and pre-testing time was a lesson I certainly learned as a technologically unsophisticated individual. The importance of fostering good relationships with community gatekeepers and organizations. The one thing I felt critical is a demo mode, that you really needed a demo mode to be able to, as you went out to these families and worked with a boy or girl, got them set up with the equipment, to be able to literally run through the screens, have them press the buttons, so they can see exactly how all this is supposed to work before they have to do it for real. Clearly, a lot of participants and us felt this idea of having adjustable reminders or prompts was important. One size doesn't fit all, and adjustable in terms of volume and in terms of frequency. We learned that continuous monitoring of the Wacket use was essential, and to emphasize to participants to contact investigators immediately if there's an issue. You don't want them not using this or getting hung up on something only to find out that it could have been corrected very quickly by a quick trip out to the household. I felt that the querying motion and sound events was promising, but that it frankly needed additional work, that the algorithms perhaps needed some tweaking. Perhaps in rethinking a little bit about grouping so many events together where you'd get a long string of events that could be an hour in length might have made it more difficult for kids to answer those questions. And lastly, we had the advantage of insuring equipment because we did have some issues with smartphones malfunctioning or getting broken in one case, and we have an insurance policy here that we could actually put the smartphones on. We couldn't do the Wockets; they were experimental, but we could insure the smartphones. So last, I just want to acknowledge really quickly the families who literally let us into their bedrooms. All the hard work of the research team I was honored to work with. And lastly, our funder, the National Institute on Minority Health and Health Disparities. So thank you very much for your attention. I hope this was useful.
Thank you, Jim. That was very useful, and I think I'm still, from my time in the tech sector, had some PTSD flashbacks from some of the issues we had to deal with. Given time, there's a couple of questions that have already popped up on the chat room, and I'll just remind people that if you haven't asked it, you can send that. But the first one I think is really almost two questions. One has to do with, did you also test mothers and their sleep patterns, and do you have any data on white versus African American?
Right. So no, we did not measure the caregivers' sleep patterns in this study. Unfortunately, we were a little limited in the budget, but that is certainly on the agenda for a follow-up study, because I think all too often, and I'm guilty of this as well, that so many of these sleep studies on children or teens, they're looking at the sleep of a boy or girl, and it's really a household activity. And so I think the more that information on the caregiver sleep or other sibling sleep could be measured as well would be really important and meaningful to a study. And similarly, in terms of African American and white children, we were limited in our budget to focusing, taking an initial step with this system with a sample of African American boys and girls. And clearly, what we hope to do as a follow-on study is to involve a larger sample, more ethnically diverse, that would include different groups, so we could make those kinds of comparisons.
Good.
Indeed. Excuse me, this is Bill Elwood. Great job, Jim. I think it's important to point out to our audience that doesn't know your data are based on an R21.
Correct,
which is
yeah.
Right. Back to you, Bill.
No, thanks, Bill. And I think this is related, Jim, because the question is about next step. I mean, obviously this is a small sample size. So I will say that one of the things that I always think is unique and nice about sensor and EMA type data is that you can use relatively small samples because you have such intensive longitudinal data within each of those individuals. But just thoughts about your sample size and how you'd like to expand in the future.
Yeah, I mean, as I said, this was tiny. You know, I would hope in the future that we would be able to generate you know, samples of I don't know, we're talking, you know, about like 100 kids per sample or per group, something like that, maybe even more if we really want to get into looking at gender differences, which I also think could be important, perhaps even beginning at this age. So I think our next steps, we're interested here in Cleveland of you know, adding certainly including a group of white children, a group of Hispanic children. Most of the Hispanic population in the city of Cleveland is Puerto Rican in origin. We think that would be important to add to the sample as well.
That's great. So Jim, in the interest of time, I think we'll stop this, but I want to thank you again so much for presenting today. This will end today's seminar. Everybody have a good rest of the day. And Jim, thank you again.
Oh, thank you for the opportunity.
Bye-bye, all.
Bye.